We also have a presentation tonight on School-Based Health Center for the Round Lake Area School District. Not sure who would like to present. I think you're going to be using the screen behind us.
Yeah. Okay. Brian, it should be, right? Okay. Perfect, thank you. Thank you very much for inviting us to come tonight. My name is Brenda Bannor. I'm a partner in Millennia Consulting, which is a consulting firm that's been in existence for 15 years. We work with not-for-profits and government organizations. My area of expertise is health and education. I was a teacher in the Chicago Public Schools for 14 years and worked in medical education. What we'd like to do today is we're going actually to all the villages and sharing the work that's been done up until now, and sharing with you sort of where there's a committee. About a year and a half ago, a group of concerned Round Lake area organizations came together, about 16 organizations, to talk about health care access of Round Lake youth and how it was impacting academic performance, and sort of to figure out what to do about it. I was engaged by NACASA, who got a grant from the Healthcare Foundation of Northern Lake County to help facilitate the process, to do a feasibility study, and then based on the results of the feasibility study, to do some planning to see how to really bring healthcare access to the youth of Round Lake area. So what I'd like to do today is share with you some of the findings, what we've done today, the healthcare status of youth, and then one solution, possible solution, a school-based health center for Round Lake District 116. So anyhow, okay. What I'd like to do, this is just a snapshot, 5 different communities, which is really very interesting. I'm not used to this, and so as I said, we're going out to all the communities to talk to all of you. There are 9 different sites in District 116, and over 7,000 students. The demographic trends facing in the Round Lake area school district are pretty significant. Over the past 10 years, you can see here on the left, the percent of students who are eligible for free and reduced lunch has risen over 20%. So that means that today over 2/3 of the students in Round Lake schools are eligible for free and reduced lunch, which is really just another way of describing poverty level. This obviously has significant challenges, illustrates significant challenges for the students. On the right, and their families, on the right you'll see that the race and ethnicity of the student population has changed significantly too. 2/3 of the student population now in the district are Hispanic. The African American population has stayed about the same, and the Caucasian population has gone down. So really, it's a very different looking district now over the past 10 years. What do we know about the health of Round Lake area youth? In October 2012, and this information comes from the healthcare coordinator from the district, who actually sits on our committee, approximately 138 students were excluded from the Round Lake area schools because they didn't meet the immunization and physical health compliance. So they were excluded until they could in fact come back. Obviously this is a significant loss of school time, also loss of dollars to the district. And you'll see later why it is that a lot of these students weren't able to get physicals and immunizations. Between 2009 and 2012, there have been at least 120 pregnant teens in the Round Lake School District. And you'll note, we didn't put in here the Round Lake High School because some of those pregnancies actually were in middle school. I want to take a second here to talk about national trends. Some of you might have read in the papers recently that the national trend in terms of teen pregnancy has actually gone down. However, in the Round Lake area, this is not the case. If anything, it's been the same or going up. And actually, if you look at other communities in Lake County, Mundelein, Waukegan, North Chicago, their teen pregnancy rates have actually been going down, but not the case here. Also, according to a self-administered survey, youth survey, administered to over 1,300 Round Lake area students, 17% reported mother-only living arrangements. This actually mirrors the number in the city, and there's a lot of research that shows that living in a single-family home like this really adds to risk factors for students. 13% of 10th graders, 15% of 11th graders, and 13% of 12th graders have seriously considered committing suicide in the past 12 months. That's very, very significant. The current reality of health services at Round Lake High School, and again, as I said, the health coordinator is on our committee. And so she said that between every day, about 30 to 35 students comes into the health office. This is only for the high school here. They have to send home almost half of those students because they can't really provide the services for them on site there, so they're sent home. And this is just a list of the types of things that they can provide services for, and they do. Here are all the kinds of services that they cannot provide, and these are some of the reasons that the kids are sent home. Treatment of students who've been chronically sick for several weeks. The healthcare coordinator actually shared with us that kids will come in and they've got a chronic cough, they've got a chronic illness, or chronic sickness, and for some reason, either they're afraid to tell their parents, they don't want to bother their parents can't take time off of work to take them to the doctor, and so they're dealing with this day in and day out, and really have to find places to refer the students out. What do we know about access to health care for Round Lake area youth and their families? And actually, this information comes from a report that was done by the Healthcare Foundation of Northern Lake County, and also from some of our interviews that we did for the feasibility study. And I don't think any of this will surprise any of you, that there are limited primary health care options in the community, that it's a long time to get an appointment, for example, at the Lake County Health Department, particularly if you have Medicaid. And actually a lot of, in some of the focus groups that we had, parents were saying that there are very few doctors now, and it's becoming less and less, doctors who will take Medicaid. So actually parents now travel very far to get care. Some of the parents in the focus group are saying they travel to Melrose Park, they travel to Chicago to get care. And also very difficult to find specialty care. Transportation is a huge barrier, and again, I don't think I need to tell you that it's really difficult to find public transportation, and a lot of parents don't have driver's license. Increasingly, parents can't afford care, and in all of our focus groups, we have so many parents who were talking about the fact that they either had lost their job or it was imminent they were going to lose their job. And then child care and work challenges, and again, this speaks to...
Ma'am, can you get a little closer to the mic?
Oh, I'm sorry.
They want to be able to pick you up, okay?
Oh, okay.
Well, you are on TV, so...
Oh, okay, fine. All right, thank you. Let me just fix my hair. Okay. Is this better?
Yes, that's better.
Okay, thank you very much. Yeah. And just keep reminding me, I tend to walk a little bit when I talk, so just sort of go like that and I'll move over, okay? Thank you. As I said, there are a lot of single-parent homes and also a lot of homes where there are two parents working. It's very difficult to take time off of work or to take, your children, if you're doing the daycare, the child care, to appointments for doctors. So it's really there are a lot of challenges there. So how to keep Round Lake area students healthy and ready to learn? One solution are school-based health centers. School-based health centers have been around since the 1970s. This model has been growing significantly. Today there are over 2,000 school-based health centers across the nation, and there are about 60 in Illinois. And I often say that what I'm going to tell you is sort of what school-based health centers generally are, but when I say there's 2,000 school-based health centers, there are 2,000 different models, and what's really important, and I want you to think about this as I'm talking, is that the school-based health center has to represent what the community is. So, and that's part of why we're going out and talking to different communities, and we're going to be talking to lots of stakeholders to get feedback, to hear what the community wants, because we want this, if this happens, to be the Round Lake School-Based Health Center. So it has to represent the values, it has to represent the culture, it has to represent the people of the Round Lake area. So school-based health centers are exactly what the name implies. It's actually a primary health care office in the school. So you open the door, you walk in, and there's exam rooms, there's a lab, there's a waiting room, mental health room. It's operated by a qualified healthcare provider, and it's operated in accordance with state and local laws, so certifications, all of that. And actually, the state of Illinois, the Illinois Department of Human Services, certifies school-based health centers, and it's a very rigorous process. And as I said, it's a growing model, and actually it's been and being recognized now by the federal government. There are specific grants now out from the federal government to, and actually I'll talk about this later, to support the model. Who provides the services? There's a medical director, usually a pediatrician or family practice doctor, a nurse practitioner. The nurse practitioner or physician assistant, which is a mid-level, provides most of the day-to-day care. There's a behavioral health worker, a medical assistant, and a receptionist. I want to just take a second here to talk about the behavioral health worker. This is an important piece of the school-based health center because actually across the country the #1 diagnosis in all of the school-based health centers is mental health. Okay, so it's really imperative. We've had cases, students will come in and they'll say, I have a stomach ache, and they go and they talk to the nurse practitioner, and after the nurse practitioner listens and talks to them and hears what's going on, she or he may realize that, you know what, this is not really a stomach ache, it's something else, and then they can seamlessly walk them over to the behavioral health worker to figure out what's going on. And this is a big question, how is it funded? Local tax dollars, and that's important, local tax dollars are not used to operate the school-based health center. The school does not pay for it. It is located in the school, but it is separate from the school. They're supported, school-based health centers are supported by a variety of funding sources, including billing. And I would say billing is a primary. So you've got your qualified healthcare providers, so just the way that they support themselves in their community health centers is how they support themselves in the school-based health center. Private foundations like the Healthcare Foundation of Northern Lake County, sometimes corporations, local businesses, federal and state grants, donations, in-kind services. And as I said, they operate within the schools, but they are administered and they're very separate. And they do not interfere or take money from the school's educational mission. It supplements the educational mission. Who will be able to use the services? All students will be eligible for services regardless of their ability to pay. Enrollment in the school-based health center is not mandatory. It's not required. It's encouraged, but it's not required. So if a parent does not want their student to go to the school-based health center, they don't have to sign a consent form, and the student doesn't have to use the services. Now, we certainly encourage it, but it's not mandatory. And to enroll, a parent or a guardian must sign and submit a consent form for the school-based health center. Students will not be seen unless they have a consent form, except for a medical emergency. So for example, if a student has difficulty breathing and they bring them down to the school-based health center and they don't have a consent, certainly they're not going to let them suffer with, they will try to call the parent to get consent, they will take care of the student, and then again call the parent to let them know what happened. But that's the only cases that they will be seen without a consent. And students can use the school-based health center even if they have their own primary care doctor, and all efforts, the nurse practitioner or the other providers will call the student's provider to make sure services are aligned. Benefits, keeps students, it promotes student well-being and academic success. It keeps kids in school. If kids aren't in school, they can't learn. So for example, the nurse practitioner, the healthcare coordinator was talking about all these kids that she's got to send home. Some of these kids could have been seen at the school-based health center and could have stayed in school. So for example, if a student has asthma, they can come down to the school-based health center, they can have a nebulizer treatment, sort of rest for a little bit, and then go back to class rather than having to go home or sometimes go to the emergency room. It improves access to care, it's accessible, it's affordable, and there's a focus on prevention and early identification, so you can really catch things before they happen. And the benefits to the community, it will save the school district money by decreasing absenteeism. The district loses about $24 a day in state aid for every student who's not in attendance. So if you increase that, the number of kids that come in school, like I said earlier, not only will you have kids sitting in seats and learning, but also will save the district money. It reduces emergency room visits and decreases hospitalization. And the other thing that's really important is less lost job time for parents. So parents don't need to take time off work to take their kid to the doctor or to see a provider. What do people have to say? These are just some quotes. I'm not going to read them, but it's from a principal at a middle school student and a parent, all talking about the positive ways that the school-based health center has impacted them. The principal saying that she has not seen attendance rates as high as she's seen them since the school-based health center came to her school, and the student talking about how her life has changed because of the school-based health center and asthma. This is just to show that these are again the reasons that the healthcare coordinator at the high school said that she had to send home students. And you can see here, a lot of these things could have been addressed, all of them really could have been addressed by the school-based health center. Again, not to say that every kid, I mean, if a kid is very, very sick, they might have to be sent home, but a lot of these things they could have taken care of. And you'll see here for dental care, referral not on site. Operatories are very expensive. Dental operatories are very expensive, and so there will be arrangements for collaboration in referring students to the Lake County Health Department. So planning, these are the stages that this committee of 16 organizations has gone through. We did the feasibility study, we're in the planning phase, and then hopefully implementation. And again, the planning is really important because this needs to look like Round Lake, and this needs to be accepted by Round Lake. This is what we did in the feasibility study. We have the advisory group. We identified the site, which is the high school, because it's got the most students and it's most centrally located. The Lake County Health Department has been identified as a healthcare provider, but we have Advocate Condell around the table, we have Vista around the table, and we're going to have Rosalind Franklin around the table as well, all providing services. And that was one of the things that the Lake County Health Department said. They didn't want to do it without collaboration across all sites. And actually, Nikasa is at the table, and also Mano a Mano. And then we had approval given to move to phase 2, the planning stage, by the district, the school district, and also Lake County Health Department. Now we're in planning. We've created some basic assumptions and identified community questions, which I'm going to share with you in a minute. And now we're in the process of gathering community input. This is the first step of doing that. Delineating the Round Lake School-Based Health Center model of care. What services will be provided? This has not been decided yet. We are in the process of talking about this. Developing linkages, we're in the process of obtaining funding, and then creating a business plan. So what are the assumptions? Local tax dollars will not be used to operate the school-based health center, number one. Students will only be seen if they have a signed consent form. That's really important to know. Creation of the health center is dependent on securing adequate funding for build-out and operations. So if there isn't adequate money, it's not going to move forward. A federal grant just came out for capital funding, so that's an opportunity. It's anticipated that the earliest the school-based health center would open would not be until the 2013-2014 school year, again, because of the planning that needs to happen. It will grow slowly and intentionally. So the high school would be the site, Initially, it would only serve the kids, the students at the high school, and then students with severe needs from the middle and elementary schools, because the healthcare coordinator again said we have so many sick kids, we really need to have something for them. That would only be through appointments. And then once once things are in place, we'll talk about expanding it to the elementary and the middle schools, and maybe even families, but not till down the road. And it will be operated as a collaborative, and that's what I said, that VISTA might provide psychiatric services, NACASA behavioral health services, mano-a-mano outreach, so it will be a community effort. These were the community questions. These are what people were questioning. Space. Will this be taking classroom space away from an already crowded school? And parents were very concerned about that. This happened at a really good time because the district is undergoing its master building plan, which I believe they presented to you. So the school-based health center, there is a place that's been carved out in that would be side by side with the existing health office. So the health coordinator, the school nurse, the health coordinator would all be part of the same seamless space. Cost, will this impact local tax dollars? What will it cost the district? And then I said it won't cost the district anything, and it will not impact local tax dollars. Target population, I just spoke about that. The staff, will any staff be losing their jobs? How will this, because I know a lot of times when a school-based health center comes, the counselors are nervous, the school nurses are nervous that you don't need them anymore. This does not supplant it, it just supplements the services. Role of parents. Will students be seen for confidential services if they don't have a consent form? No. We have decided as a group that they will not be. If they don't have a consent, okay, how will parents be involved in their children's care? Parents will be involved in the sense that they need to have signed consent, but also parents will be it will be called if there's issues in terms of medication, things of that nature. Now I do want to say in all transparency that Illinois does have a law, a consent and confidentiality law, that says that youth 12 and over can be seen for reproductive health, mental health services, and substance abuse services without consent of parents. Again, we have decided as a group of this advisory group that the law does not say you have to see the students, it says you can see the students. So in terms of if a student doesn't have a consent form signed, that they would be referred out and they would not be seen at the school-based health center. But if a student does have a consent and they don't want their parents to be told by law, the nurse practitioner needs to abide by that law, but I want to assure you that every effort is made to include the parents. But I just want to be as transparent as possible about what the law is. And then menu of services, I have a big question mark there. This is what I said. We don't know what services are going to be provided. And then sustainability, we need to create a business plan for this. Menu of services, okay. According to the Illinois Department of Human Services, all school-based health centers have to provide primary care, behavioral health, health education, and referral for oral health services. Okay. This slide is very busy because there are a lot of services that need to be provided. So the top services here need to be required on site. And this is not something that we as a committee have decided. This is something that the Illinois Department of Human Services requires for all health centers to be certified. So physical exams, immunization, diagnosis of treatment, management of chronic conditions, reproductive health services to include abstinence counseling, diagnosis and treatment of STIs, pregnancy testing, cancer screening and education, basic lab tests, medication, behavioral risk assessments, which is really asking students about risky behaviors and trying to get in front of it, and then behavioral health services. So these are the services that have to be provided. There are services that are recommended to be provided on site, but are not required by the Illinois Department of Human Services. And those are reproductive health services, so that's prescription and dispensing for disease prevention and pregnancy prevention, and treatment for prenatal and postnatal care. If these services are not provided on site, there's a referral system. And so when I said that the decision for services hasn't been made, this is a section that really hasn't been determined what will be provided on site. And as I said down here, no decisions have been made, and that's part of that planning process. I do want to share one thing. A lot of focus oftentimes when we open school-based health centers is around this last section here about reproductive health. And the truth is that, as I said earlier, and I want to underscore it, that is not the #1 diagnosis in most of the school-based health centers. It gets a lot of attention, but the #1 diagnosis, as I said, is mental health, and also a lot of prevention services, a lot of physicals, a lot of immunizations, and a lot of asthma. And this community, according to Health Coordinator, has a lot of asthma and also a lot of diabetes. So I'm going to stop there, I think. Okay. Would you like me to entertain any questions, or?
Any of the trustees have any questions?
Sure, I have questions. I've been reading your presentation. I have a copy of it since I got my board packet. And here in Round Lake Beach, as an elected official, we have 5 school districts in Round Lake Beach, and we work good with the other taxing bodies. And I thought to myself, why are we seeing this? Why are we going into any detail as a village board? But I think you answered that tonight, because you're just gathering community input.
Right.
And so, as a parent and a resident here in the community, that's where I'm going to come from, asking questions. First of all, I mean, we at work, we do have health providers, and I go to my local doctor here in town and take my kids. I heard you say I wouldn't, for convenience, I could send them to school sick, I guess, and they'd go to that clinic. I don't understand that. If my child is sick, I guess I'm old school. I kept him home and I'd take him to school. I'd make sure he went to the doctors. I have a POS, which I pay a $35 copay when I go to the doctors. Now, if I went to your clinic, is my son going to have to pay $35 to go to the clinic? Or how does that tie in with my insurance?
Mm-hmm. Yeah, and that's something that you will have to work out. I can't tell you right now exactly how your insurance would work, and that's something that we would talk with you, and the Lake County Health Department would work with you on that. But in some cases, yeah, their copay, you do have to do copay, and then it might not be the best solution for you.
Okay.
Yeah.
All right. With that being true, I mean, we do have the Lake County, clinic here in town for folks and our doctors.
Right.
I'm just trying to come up why we really want to put a health clinic in the schools, and why do we? Well, we have all this other in our backyard here.
Right.
I don't know where this came from. If these outside resources came to the schools, or if the schools reached out to them. On page 5 of your presentation, you said in October 2012, 100 and so many kids weren't able. This is only May 2012. Is that a typo? Is it supposed to be 2011?
Yeah, it should have been 2011. Yeah.
Because I couldn't understand, because
no, that wouldn't have made any sense. Thank you for
required to have
yeah.
your shots, your immunizations. I remember when my kids went to kindergarten, and
right.
They had to have, back then, in I think 5th grade, there's a couple times.
Mm-hmm.
You had to have to go to school. I mean, I can't see where those 138 kids would be. They'd have to get the shots when they come back to school. So I'm just trying to
Yeah.
And there's ways to get their shots, you know, without having it in school, I guess. If I give you a consent form, and my consent form, and then my son gets a paper cut, you know, that's fine. Then I know he's getting well taken care of in your clinic. But then do you notify me that he's been there? Because I have that $35 copay, and I need to know what's going to be going out for my budget, you know, so does any time that my children go there, are you going to notify me to let me know?
You know, that really will depend. I can't say that every single time that a student comes that the parent will be notified. In terms of if that's important to you, you could speak with the nurse practitioner. I mean, a lot of this is relationship developing as well. And so that would be on an individual basis. Most of the time, if it's something that requires medication or something that really requires some kind of plan with the parents, then the parents will be called. If it was a paper cut, honestly, I don't think they would call you, unless you needed to be called.
Well, I know I'm going to pay a $35 copay.
Right.
I need to know when my child goes to the doctor. If I, you know, if he hurt his hand worse than that, and I took him to the doctor, I know I had to pay my copay. You know, I want to make sure.
But again, we work very closely with the students to let them know, to inform their parents.
When you're talking pregnancy and reproductive, is this being funded by Planned Parenthood?
No, Planned Parenthood is not involved in all of this.
Because you're talking about pregnancy and giving out condoms and contraceptives. I mean, I teach my children abstinence, and I don't want that given out. So if I had given you a consent form and they went there, are you going to give it to them when I don't want you to?
Well, first of all, we haven't decided what the services are going to be. The other thing is that if you don't want your child to, and that's because that consent form, if that's not something, if that would be what was decided and you weren't comfortable with that, then you wouldn't have to sign a consent form, and then your child wouldn't come to the school-based health center, and that wouldn't be for you, and that wouldn't be for your family.
Well, I'm just trying to say, if it's not funded by our tax dollars here in Raleigh Beach, the money, like you said, comes from corporations.
It comes from billing, mostly billing. So it's just, for example, it's like the Lake County Health Department that, you know, they bill Medicaid, they bill insurance, and so that's how they continue to function. And essentially, that's what the medical services, a lot of the foundation funding, Medicaid doesn't really pay much for mental health, and so and Medicaid pays nothing, and insurance doesn't pay anything for health education, and those are important parts of it. So that's where the foundation funding comes into play, is to support those aspects.
And I understand, and that's why I go back to my original question about billing, because if my insurance is going to be billed, I need to know
right.
my child.
And I understand that.
So I've got an issue with that whole concept.
Okay.
Yeah, and just trying to.
No, I appreciate that.
Figure that out.
Other questions?
I have a question.
Sure. Just say something. Eric, do you understand though that
We can't hear you. You're going to have to come up with my guy.
do you understand that if your child goes to their primary doctor and asks for condoms, that doctor does not have to tell you, no matter where you go? Unfortunately, that is a state law where certain things are confidential if a child is 12 years of age or older. And they can come in and tell your own pediatrician that they're using drugs and they don't want to tell you, and that doctor cannot tell you.
Yeah,
So that's just not specific to that school-based health center. That goes without saying.
Yeah, I don't understand that whole complex, because I know if I'm being charged, if my son or daughter goes there, or if I go there, I want to know what's going on. I don't know what the doctor can or can't tell me. You know,
It would be the same thing with drug or alcohol use.
yeah.
They can't tell you without the child's permission. And I believe Brenda said earlier, we will do everything we can in any of those cases to have that conference with the child and explain to them how important it is that the parent get involved.
So you said if there's a law about, and I think you said 12 and older. So if I've got a 12-year-old daughter at the junior high and she comes in, or a son, you're going to give them condoms for a 12-year-old? Is that, I mean, how young do you give this stuff?
Well, yeah, first of all, again, we haven't
Focusing.
Sorry, we haven't decided what services will be provided. And if you don't want your child to go there, you don't have to sign the consent. The other thing is that you have to understand that the providers, nobody wants to give a 12-year-old a condom.
Thank you.
Nobody does.
Thank you.
You know, and I'm a parent of well, now they're grown, but they were teenagers. And believe me, abstinence is the first line of conversation. But the reality is, given the numbers that we saw with the Round Lake High School community, that 53 pregnancies each year, some kids are in fact participating, and so that's a reality also that we have to balance.
And given these referrals, and given these referrals, is abortion an option that they would give to a 13-year-old?
We do nothing with abortion in these school-based health centers.
That's not an option?
That's not anything that we would do in the school-based health centers. That's not part of what we do. Thank you.
Believe you had a question?
Question I had, you stated that there were 60 of these health-based centers within Illinois. What is approximately the closest one connected to the Round Lake area?
Well, we went to visit one, we meaning this group of people, in Aurora. There's one in Evanston. And there's one actually in South Beloit and in Rockford. But there aren't very many in this community.
The other question I had is going back to is what, I'm pretty sure what Larry was asking regarding the consent. You said the child will not, if there is no consent, they won't be seen. But what if a child comes to you or to the health center and is sick and discovers there's pregnancy involved? Then what occurs at that point?
Well, we wouldn't see them. If they came to us and they were sick and they didn't have a consent, what we would do is we would refer them back to, they wouldn't even be sent to us, because the truth is what's probably going to happen.
If they're sick, they would go to you, right?
Not if they didn't have a consent, no, because what would happen, if you imagine, right now what happens is students go to the health office. And so we would be co-located near the health office. So they would go first to the health office. And the health office would actually act as a triage, okay? So they see certain things now and take care of certain students now, okay? The ones that they couldn't take care of, they would refer over, but they would only refer over the ones that had the consents. So if your child came and was sick and didn't have a consent, they wouldn't get to the school-based health center because they don't have the consent to go there.
But if they had the consent and they were ill and test and lab, as you said,
Right.
that would be provided.
Right.
Pregnancy test, I'm assuming, and they knew when it was positive that they were pregnant again. Parents do not have to be notified, is that correct?
They don't have to, according to law. They don't have to.
But I'm asking in this
No,
scenario,
because
not law.
they have to, as I said earlier, they have, the practitioners have to follow the law just like all the other doctors. But the truth is, in my experience in these health centers, every effort is made to encourage the students to involve their parents. And there are situations where students can't or don't feel safe doing it, but the reality is that every effort is made to do it. So, but what happens in the health center is really what has to happen, or mirrors, as Nancy said, what would happen if your child went to their doctor and found out that they were pregnant, and the doctor really couldn't tell you either unless they got the consent of the student.
And I believe one other question, I had a few here. You also indicated at this point, there is no, I guess there's nothing further as to what services that you are gonna provide.
Right.
And how are you gonna make the calculation as to
Well-
what services to provide?
Okay, and that's a really good question. Well, some of the services, as I said, some of the services have already been determined by the Illinois Department of Human Services. The other is going out, listening to questions, hearing feedback. We're going to be doing focus groups lots of focus groups with parents, because the parents are really the key people here. And so going out, and we have our committee of 16. It's not me that's going to be going
No,
out and
probably
talking to the
separate
parents,
previously.
because the reality is I'm not from this community. I recognize this. I can bring my knowledge, but it needs to be the people from the community talking to the community. And so our group of advisory committee members are actually going out into the community, meeting with parents, meeting with other organizations, and talking to people and getting feedback. And at the end of the day, they will make a recommendation of what it should be. But we have a ways to go before that's decided.
I guess this is my last question, I may not have heard, regarding as to the plan itself. I know you're going out and touching bases with all the community to see the partnerships that are involved. How did this come about? I know Larry, thinking back, pretty much he asked almost the same question. Did the school come to you in regards to this, or did you come to the school?
Oh, no.
How did this connection happen?
Right, yeah. Actually, this whole process happened long before I came to it, actually. The whole issue of kids missing school, and also parents being concerned in terms of health, and community organizations seeing the health issues. So the group of people, these organizations got together to talk about this, and then applied for funding actually through the Healthcare Foundation of Northern Lake County, who actually, they had experience, or the executive director has experience with school-based health centers, having seen them work successfully in other venues. And so he was actually part of this group too, and so he suggested looking at school-based health centers. And the school was one of many people sitting around, one of the members sitting around this table. And so I'd say about 6 months into the process, they came and engaged my firm, because
Who's they?
I'm sorry,
Who's they?
the NICASA.
The committee or the
well,
school?
no,
NICASA.
the committee, not the school. No, NICASA wrote a grant, and they got funding for the Healthcare Foundation, and they realized that NICASA and this organization, couldn't do this on their own. They needed a facilitator. And so NICASA, I can't remember how they actually came to me, but I know, they went to the Illinois Coalition for School Health Centers, who gave them my name. So that's how it came to be, but they had already been talking and already been having meetings. Okay? Thank you.
I just have a couple questions, because I don't want you to feel like you're being beat up.
No,
so.
it's fine. This is
This
what
is
this
the
is
time for
for.
it.
We understand this. This is fine. This is good.
My concern, I don't even know how to express my concern candidly, because I do PowerPoints for a living and I give presentations, and so I think that whatever you lead with is really, more often than not, the driver. You started out with the ethnicity of the student population, and then you immediately went, before you started really talking about other health issues, you mentioned the reproductive issues going on at the school system, and then you led into all of the other health issues. I like the idea of all of the health issues being looked at. I am concerned that we're going to throw the baby out with the bathwash here. However, I really kind of take umbrage with the fact that when Trustee Mount was asking you questions, you said, well, we'll try to work with you on some of those things, but you really got to know that with the health laws, we can't tell you. So what the question that just immediately popped into my mind, so what laws will you break, and what laws will you not break? If you can't say anything really at all, how can you work? How can this health center work with expressing anything going on with the students? When the reality is as parents, we can't do anything. And then secondly, because many of us who are fortunate to have health insurance in this country, you have like a PPS. I have a PPO, and so my children, if they were still in school, they went through the Round Lake school system and gone, could not participate in this at all, because the only way for anyone who has a PPO to participate in this is if the organization would apply for membership in the PPO. And you and I both know that's not going to happen. And so what we're doing is, this is another function for taking care of those without insurance, which I applaud, but let's really call it what it is. And I'm happy, I'm grateful, I love the idea that we're taking care of the health issues, but I think this is really also masquerading as a way to address unplanned pregnancies.
Well, in terms of, and I'd like to talk to you later about the PowerPoint. I think that's interesting, your take on that. But in terms of parents not knowing, parents can know a lot. It's just this one small. It's not small, but the law is the law, and it covers those, again, reproductive health, mental health, and substance abuse. If your child comes in, has asthma, has a flu, has stomach ache, whatever, there's no reason for you not to know that. In terms of this masquerading for reproductive health, again, there is an issue in the Round Lake area school district in terms of unwanted pregnancies, but that, again, that's a small part of what goes on day to day in the school-based health center. I know it seems like it's large, but it's really, it's not the bread and butter of what is done there.
Then I will ask you, why did you leave with it?
Because but the issue of the pregnancies is a huge issue at the high schools. That's a huge issue. That's not what the school-based health center is going to focus on. But in terms of what some of the challenges are for the high school, the reality is that's a huge challenge. These are girls that may in fact not graduate, whose lives are being determined there. So that's why that was led there. Those are the statistics that the health coordinator gave us. So that is a major issue there.
I have a question. It's about sustainability and accountability.
Mm-hmm.
If the school board and school district are not part of the clinic in any way, and this is being done with grant and private funding,
Mm-hmm.
what happens to the property that's going to be built if and when the grant runs out, or if for some reason the clinic is not sustainable by billing and private contributions? Is the build out being done by the school district, or is the build out being done under the grant?
Well, a couple of things for that. The build out hopefully will be done through grant dollars. The school district, it will be incorporated in the master plan, but if in the assumptions that we put there, if no external dollars come in, this will not happen. So the school district will not support the build out. That's just a given. Okay. So if the only grant dollars for sure would be to build that. It's too costly to even think of donations. In terms of the actual sustainability once it's built, that again, a lot of it is most of the sustainability will depend on billing. And the donations is a small part of that. Again, the donations, and not even donations, the foundation funding is what the billing will cover the medical services. The foundation grants, cover a lot of the mental health, the extra mental health, and the health education, those kinds of things.
And just as far as my opinion on having the center at the high school, we have seen a need for the students of Round Lake schools to have good medical care for quite some time. Through BEST and Mano a Mano, we've been running the summer Back to School Festival where we've been offering free physicals, and it is overwhelmingly demanded. So I think that when you consider the nutritional counseling, the stress management services, the mental health care, the sports physicals that may enable some students to participate who couldn't otherwise, that there are great benefits to having this type of facility. I would hope that there's a way to work out the reproductive counseling concerns in such a way that they could meet community standards. And I think I'm hearing that you're very open to that. It will always be a challenge to help people understand that in private care as well, there are laws that supersede. When I as a parent took my 12-year-old, I always assumed that if there was anything a parent should know, that that doctor would have told me. And of course, that's not true. I also assumed when I took my kid to college that I had a right to know what the grades are because I was paying the tuition. Wrong there too. Right. So there are many laws that sort of trod on parental rights, and I think that in the discussion we're going to have to try to tease that out and realize. But if the parental consent form for treatment could include an opt-out on reproductive counseling, that's something I would hope that the group would consider, because if that could be in place, it may allow for treatment of the other issues and bring a level of confidence to people that there would not be reproductive counseling involved.
And there are health centers who do that. There are health centers who provide full care. There's some who provide none of those recommended services, and there's some who actually have an opt-out and opt-in. So there are a lot of possibilities, and again, that's why we're going and talking to people and trying to figure out what to really listen and to bring it back to the committee. So thank you.
In the process of collecting information from the community, will there be meetings in the future, town hall meetings, places perhaps at a website where people could volunteer to be part of a policy-making group? What will be the potential for people to give input on
and what we're doing right now is, like I say, going out and talking to the villages, sort of sharing information, letting people hear what this is. And then there'll be some community forums where people can really ask their questions. We'll be doing surveys, and it's actually a really good idea to have some kind of interchange with the website. So we're having a communication strategy of sorts. So yes, absolutely. This is very slow and intentional. We want this, as I say, to work and to meet the needs of the community. Okay.
Thank you.
Thank you very much.
You had mentioned about the absentee rate dropping at some of the facilities. Do you have, is it like 1%, 3%, 5%? How much of a drop do they see on average?
You know, I'd have to look those numbers up for you. I don't have them on the top of my head, but I can certainly get back to you.
Okay.
Okay?
And what problems do you see with students forging these consent forms? My kid can sign my name real good already.
Well, actually, what some schools have done, depending on the school, for example, I mentioned to Trustee Valdez that Evanston has a school-based health center. They require that parents come and sign in person the consent form, and that way then they can make sure too that the parents understand what they're signing. So that's certainly something that could be done.
Thank you.
Okay.
Any other questions from the trustees? Do you want to open up the audience for questions at all, or do you want to?
Sure, it's fine. I'm here.
Anyone in the audience have any questions on this program?
I have one question. There were supposed to be some community committees being set up, and they were on the calendar to start setting up some stuff, and then they got pulled back off of the district calendar and kind of went underground. Nobody's heard anything about it for the whole school year now. I wonder what happened to them.
I'm not sure. On the school district calendar?
Yep.
For the school-based health center?
Yes.
That wouldn't have been on a school calendar.
It was. I came to one of the school board meetings and specifically asked that question, when they were gonna start and stuff, and then they got pulled back off the schedule and never went back on again.
That was these committee meetings that were, this group committee, and then the advisory, because it was at the school.
Right, and then I was told when I talked to the superintendent that night that they were gonna have community involvement and set up committees of the community members, and that was gonna be the first meeting. It had to be rescheduled, and then it got pulled off and nothing's ever happened the whole entire school year. That was last July.
I'm not aware of that, so I'm not sure.
I will check on that. I think this is what's come of it, is these community meetings and then the community forums and the town hall meetings.
Right.
Is what the result of that was. This is a work in progress. And as we work along and decide what we need to do, as opposed to just having a few community members come in, we're gonna open it up this way. So our next step was to visit the villages so that they were aware of what was going on, so that if community members came to them, they would be prepared to answer those questions. And as Brenda said, we're gonna be having community meetings. I think Judy's idea to have something on a website where people can have input is an excellent idea. But again, this is a very slow and deliberate process. And as these things happen, we will invite community members too.
Any other questions from the audience?
Mayor, I've got one for Nancy, if I could. Because she said that this is not funded by tax dollars, and she made it clear that it's separate from the school district, but yet it's on the school grounds. This advisory committee, are you on the advisory committee and other members of the school board? Because we work good with our other taxing bodies. I just wanted to know where you stand and where the school board stands on this.
I sit on the committee from NICASA.
So you're on the committee from NICASA?
For NICASA, yes.
Okay, you're wearing your other hat.
I am. I'm
Yeah,
wearing my
okay.
NICASA hat.
Okay, NICASA, but not the
Because
school.
NICASA originally had the grant to
Right.
do the feasibility study.
Okay.
That is when I sat on the
That's
committee.
Okay.
Okay, Karen Smith, Kathy Myers, Dr. Collins.
Right.
Is that it that sits on
That's-
from the
yeah,
school?
that's it.
Those
From
are
the
the three that are on that
Right.
committee from the school.
That's what I was gonna ask, Dr. Collins' involvement in.
Absolutely.
Right, well,
in
yeah.
the school board. Okay.
Yes.
And
We have to
Karen
make
Smith
yeah.
is the school health coordinator, and Kathy Myers is the lead social
Yeah.
worker. So that's who sits on it from the
Okay.
school.
Thank you.
You're welcome.
Your previous presentations, you used the phrase, "no tax dollars will be spent." This evening, you've inserted the word "local." Could you explain why? This evening, you have repeatedly said, "no local tax dollars will be spent."
Right, well, actually, do you want me to talk in here, or can I turn it, what's the best thing
I
for me
can't
to do
hear,
here?
I'm sorry, I couldn't hear that gentleman.
What he
I
said was,
apologize.
at another presentation, I had said no tax dollars, and then tonight I said no local tax dollars, and he wanted to know why I had made the difference. And I'll be very honest, I had when I said no tax dollars, I think that was actually misconstrued, that Medicaid dollars are used in terms of billing, and those are tax dollars. And so that would be a misnomer to say that no tax dollars at all are used, but no local tax dollars. But the truth is that the healthcare provider would in fact be billing Medicaid. So that's why.
Still tax dollars, no matter where it comes from. It doesn't fall out of the sky. You can say the word "local" in there, but my tax dollars still go into some of these grants and various things that are creating this funding. And you didn't say anything tonight about, if this all falls apart eventually, who owns the building that's going to be sitting out in the back parking lot of the high school if it goes forward?
It's within the high school. It's not separate.
Will it be deeded to the high school?
You know what, that's part of the whole process, and I think I said this at the last conversation that I spoke at. there's an MOU, a memorandum of understanding, a legal agreement that will be written up between the healthcare provider and the school district, talking about the use of the building and what will happen if in fact there's a termination of the project. What generally, and it's very rare, in my experience, I've only seen 2 of these that have actually not continued. And what happens in those cases oftentimes is that another provider then would come in and take over. So, but that will be in the memorandum of understanding.
Thank you.
I do have one more question before we conclude.
Sure.
As far as if this were to occur, this would be held inside the school, correct? If something were to happen if a child went in for medical treatment, something occurred, where's the liability responsibility?
That's the healthcare provider.
Okay, what about the school, because it's on school grounds?
In my experience, they have not been held. And that's part of the memorandum of understanding and the legal agreement, which is crafted by the lawyers.
So at no time the school district or the taxing body from that will be held responsible?
To my knowledge, no. Mm-hmm.
But you're not 100% sure, or?
I have never, in the legal agreements, certainly anybody can sue, but they are not held accountable. Okay?
Thank you.
Well, thank you much for your time and information.
Thank you.